Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on cannabis. There are two terrific reviews for further reading, one in the New England Journal of Medicine and the other one is in Nature Reviews Cardiology, published recently. Cannabis consumption is rising due to legalization and medical applications. Endocannabinoid system plays a vital role in cardiovascular and mental health. Cardiovascular risks include myocardial infarction, cardiac arrhythmias including atrial fibrillation and ventricular tachycardia, and heart failure. Cannabis use disorder is associated with psychiatric and social complications. Cannabis is the third most commonly used psychoactive substance worldwide. Estimated 200 million global users between the age of 15 and 64 in 2020. In the US, 18.7% of the population above the age of 12 used cannabis in 2021. Cannabis use disorder primarily affects young adults with 14.4 prevalence in 18 to 25-year-olds. Medical cannabis is legal in 38 US states, recreational use in 24 states. The 2018 US Farm Bill legalized hemp-derived cannabinoids. Globally, countries like Canada, Uruguay, and Germany have legalized cannabis. Ongoing regulatory ambiguity affects research and public perception. The endocannabinoid system is mediated by cannabinoid receptors CB1 and CB2. CB1 is found in the brain and cardiovascular tissues, promotes inflammation. CB2, primarily in immune cells, attenuates inflammation. Synthetic cannabinoids, example spice, cause more potent effects and toxicity. Cardiovascular risk factors. Cannabis is linked to transient blood pressure elevation. Cannabis affects appetite, leading to weight changes and obesity. Dyslipidemia. Evidence for altered lipid profiles with chronic use of cannabis. Co-use with tobacco, synergistic increase in cardiovascular risk. There's an increased risk of myocardial infarction associated with cannabis. There's increased risk of atrial fibrillation and ventricular tachycardia. Cannabis has also been linked to structural heart changes and cardiomyopathy. Cannabis-related inflammation and oxidative stress has been implicated in heart failure. CB1 activation induces oxidative stress and endothelial dysfunction. CB2 receptor activation can mitigate inflammation in cardiovascular disease. There is involvement of the MAP kinase and the NF-kappa beta pathways in inflammatory processes. Synthetic cannabinoids act as full CB1 receptor agonists, causing more significant cardiovascular impact. Psychiatric and toxic effects. Cannabis intoxication is associated with euphoria, impaired memory, and psychomotor skills. Cannabis-induced anxiety and psychosis, especially with high THC content. Cannabis-induced sleep disorder and delirium observed in chronic users. Withdrawal symptoms, irritability, insomnia, and decreased appetite. Cannabis use disorder CUD is characterized by impaired control and social dysfunction. Higher prevalence with early onset and frequent use. Comorbid with depression, PTSD, and substance use disorders. Genetic factors contribute to 50% of disorder susceptibility. Therapeutic applications and challenges. Potential benefits of CB1 receptor antagonists and CB2 agonists in cardiovascular disease. Rimonabant showed promise but caused psychiatric side effects. CBD studied for arrhythmias and myocardial protection. Genistein identified as a potential peripheral CB1 antagonist. Public health implications. Public perception of cannabis safety conflicts with clinical evidence. The need for robust public health education on cardiovascular risks. Policy development should align with emerging scientific insights. Longitudinal studies are required to understand long-term effects. Future directions: investigate long-term cardiovascular effects of cannabis use. Develop safer cannabinoid-based therapies with minimized risk. Employ inducible pluripotent stem cells modeling to explore cannabinoid cardiovascular interactions. Enhance public health messaging and regulatory clarity. In conclusion, cannabis use is rising globally, necessitating further cardiovascular research. Cardiovascular risks include myocardial infarction, cardiac arrhythmias, particularly atrial fibrillation and ventricular tachycardia, and heart failure. Synthetic cannabinoids present distinct and potent risks. Targeted education and policy reforms are essential to mitigate risks.